Hi, I'm Dr. Hawan Lee. I'm a family physician with a group practice, Frontier Medical Group. I've been asked to share with you my experience as a general practitioner. I was quite a sick child. So when I was young, my mom used to take me to the doctor all the time, and I had a few different family physicians. So I was quite interested in what they were always doing to us, and how they managed to concoct the different colored medication for us, and then at the end of that we actually got well. I decided to work in the heartlands with private group. The reason being, in the heartlands, that's where the need is for doctors to with the expertise to basically look after their chronic conditions, to see to their needs. One thing unique to general practice is you can actually treat a family from what we call cradle to grave. It's a very unique experience that the whole family actually sees you. So you actually get to know the families very well. They learn to trust you. You don't just treat their medical conditions, you actually get to know their family dynamics. Sometimes they actually see you for advice, for support, and even the students sometimes they actually ask you for some not just medical advice, life choices. So it is a very unique experience, and you actually have time in your heartland practice to see your patients frequently, and then give them your time. So during our time when we did our A-levels, we did all the sciences like physics, maths, chem, bio. Nobody told us about money. So actually doctors are very poor accountants, and if you actually run your own single practice as a single doctor, you do not, your highest outlay would be rental, staff salary, and you do not have the economy of scale to purchase your medication, your equipment at a very low rate, unlike hospitals, polyclinics. So you actually, if you do not do your maths correctly, and if you do not balance your profit and losses, you can actually go bust. I wish somebody told me that actually anything can come through the door, and you must be prepared to expect the most unexpected. One day this lady just came in, and with a newborn baby, maybe less than a month old, and she was crying, and she just dumped the baby in our arms and ran off. So we didn't know how to handle the situation, and we didn't know what to do. We scrambled to check whether she was actually our patient in the first place. Eventually we did find her. She was suffering from postnatal blues, and she just needed to put her baby somewhere safe, and she felt that the clinic was somewhere safe, while she ran home and had to deal with some emergency that was going on at home. So yeah, I wish that somebody tell me that anything can come through the door. So even though you may think that general practice is not like hospital where or A&E where there's a lot of emergency, where everything is fast paced and all that, don't be shocked. The path and the journey from medical student to becoming a doctor and life as a doctor is a long journey. And in the beginning of this journey, to know whether you can actually succeed or even last as a doctor, first of all, you must like to interact with people. And it serves you well to be a good listener. Only you can tell, that whether you have the passion to help and heal others. Only you know from the bottom of your heart. So and after you become a doctor, that's not the end, that's just the beginning, because there's postgraduate exams, there is always continued medical education, and medicine is evolving. There's new technologies, there's AI, there's new medical conditions, right? And there's always new diseases, and up to now we have not found the cure for cancer. So you must have an inquisitive mind, you must have the stamina to learn new things, to improve, to evolve and change with the time. You must have the curiosity to get to the root of the medical problem and find ways and cure for your patient. But first of all, like the Hippocratic oath that we all take when we first become doctors is, first, do no harm. Okay, that is the most important point that as doctors, or we must all have.